My name is Rigby Lloyd, and today I'm here to discuss the importance of abortion within healthcare and my solution to accessible abortions. The right to an abortion is important to me because I've always been raised to appreciate the autonomy of my body. I used to live by a Planned Parenthood when I was in kindergarten. I would see it when I was driving to school each day and admire how pretty the building was. Whenever I asked my mom what the building was for, she would respond, "They're doctors. They help women." One morning, as we were driving by, there were people with signs outside. They were yelling, and the one sign I noticed that brought 5-year-old me to tears was the one of an aborted fetus. I was so upset. I didn't understand why they were displaying that imagery, and I didn't like how hateful their yelling sounded. My mom did the best she could to calm me down and explain. She said, "Some women can't stay pregnant, and that's okay. That's their decision." Her boyfriend was distraught that I saw something like that, and later that day, I watched him come home with a sign that simply read, "I'm with stupid." He had sat with the protesters after dropping me off at school. Abortion is often overlooked for what it truly is, a safe and necessary medical procedure. Abortion has an extremely rich history, one that's not pretty. I'm here to dissect that history and find a solution to accessible abortions for everyone who's in need of that procedure. The history of abortion is very complex. Abortion has been alongside medical care for a very long time and can be traced back to the 1600s. Abortions were once unregulated and done via herbal care or other dangerous and invasive approaches, due to the lack of medical training and knowledge. Early abortions were done mostly by women like midwives and unlicensed medical providers. These women were trusted by their patients and qualified to do these procedures. Abortion has come a very long way to become one of the safest medical procedures we have today and can be sought out for various medical and personal reasons. So, with all this said, why was abortion initially outlawed, and how does this connect to the issues of today? Abortion in the 1800s had a general rule of allowing abortion before the quickening, which was a common term for fetal movement. Fetal movement normally happens around 4 months. There was another exception to abortion around this time. Women in slavery were not allowed to get abortions because slaves were seen as a form of property. Not allowing abortion does not stop abortion. Although these women didn't have access to the procedures, the fight for bodily autonomy was still there, and they resorted to homemade remedies and herbs that stimulate menstruation. In 1847, the AMA, the American Medical Association, was formed. This caused most female-dominated healthcare fields, like midwives and nurses, to be replaced by a male-dominated field. When the medical field became male-dominated, abortion was villainized and criminalized, with the AMA's rhetoric against it. This started a century of criminalization in the 1880s. Abortion was later banned nationwide in 1910. Because abortion was inaccessible, maternity death rates rose drastically. Women were forced to find underground, unsafe procedures. Abortion cases had an exception when a patient's life was at risk. The decision to perform an abortion was made by a male doctor because at the time, about 95% of the doctors were men. After the high mortality rate and lack of autonomy, women protested for the right of an abortion. Roe v. Wade was introduced as the constitutional right to an abortion in 1973. This right legalized and decriminalized abortion nationwide and allowed women to access this care for whatever they needed it for. The fight for abortions did not stop at Roe v. Wade. Recently, in 2022, Roe v. Wade was overturned, so now laws surrounding abortion are up to the state. This change to the Constitution after it had been in place for almost 50 years was not only a shocker, but an injustice. When abortion is inaccessible, it results in women finding unsafe alternatives that can lead to maternal mortality. Most abortions aren't sought out because the pregnant woman wants an abortion, but because they need one. A recent example of this is Zurowski versus the state of Texas. 13 women are represented by Zurowski. These 13 women have all experienced the need for an abortion because of either severe fetal diagnosis or obstetric complication. These women had wanted pregnancies, but due to their circumstances, they needed an abortion. It was a necessary medical procedure that they were denied to have because of Texas laws. This procedure is important because if your pregnancy isn't viable and you can no longer carry it to term, you can die without an abortion. My solution to this problem isn't quick and easy. It's to reverse centuries of injustice. My first step is education. I think abortion and comprehensive sex education needs to be taught, destigmatized, and accepted. Step 2. Abortion is an important medical procedure and needs to be recognized as such. It's important that abortion is legal. My last step is training. All doctors should be trained in abortion care. Abortion can be safe and helpful, but it takes us to take this right back and make sure every woman can access this health care if they ever need it. Thank you.